Guys, welcome back to Medical Coding with Blue. Today's episode is all about, is there an easy medical coding exam? And what do you have to know? If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so the short answer is there an easy medical coding exam? No, absolutely not. There is no easy medical coding exam. The reason that I am discussing this today is because I have gotten a few messages on YouTube about it, but I did get a message on my Facebook page that did not get posted to the Medical Coding with Blue page on Facebook because this is really an irrelevant question. The person asked, out of the CPC and the CRC, which test is easier? The answer is neither. Okay, and I sent a direct message back to that person and I said, if you're asking this question, you are not ready to take either one of these exams, because that means that you don't know what is on these tests and you're just trying to get the easiest test done and out of the way. People's thought process on if a test is easy or if it's not easy really has to do a lot with experience. There are some people that once you have become a medical coder, that yes, you'll be able to understand a little bit better about, inpatient coding or outpatient coding and that kind of thing. But it doesn't necessarily mean that when you're brand new that, oh yes, you should take this test because it's easier. I hear a lot of people say all the time that they think that the CPC exam is very easy. I know this is not true. I do not have the CPC. I will never be certified with AAPC. I will just say that, okay? There is nothing wrong with AAPC, and I'm not saying that there is. I'm just saying I'm already certified with AHIMA. I do not need to be certified with both associations. My experience and my credentials speak for themselves, okay? But with that said, I have tutored a lot of people who have had multiple failures with the CPC. And then they come to me and they say, Blue, what am I doing wrong? We get them set up on a study schedule, we do tutoring, and then they pass. Now, again, not a guarantee, but it's happened majority of the time. Now, it all depends on the person that's taking the test as well and how you take tests. For some people, they don't have to study very much and they do very well because they're able to recall a lot of things very easily. Those people, of course, they have a wonderful gift. But there's others that they really study very hard and sometimes they burn themselves out and, that's what happens. They end up failing the test. So there's a bunch of different reasons why people fail tests, but I will say that none of the tests are easy, especially of the four main ones that employers are looking for, which is the CCS, which is the gold standard of medical coding credentials. And I say it is the gold standard because it is an industry known thing that the CCS is the gold standard, because this says that you have mastered inpatient coding and outpatient coding. Okay, and I'm going to get into what that means here in a minute. The CCA, which is the entry-level medical coding certification with the American Health Information Management Association. This also says that you know inpatient and outpatient coding. And again, I'm going to get into that here in a minute. The CCSP, which is the Outpatient Medical Coding Certification, the Certified Coding Specialist Physician based. And this says that you understand outpatient coding, all right? And with AAPC, of course, there is the CPC, the Certified Professional Coder. Now, there's a lot of people that say, well, which one is easy? And it's not about which one is easy. These four tests say certain things very specifically. The CCSP and the CPC say that you understand outpatient coding. Now, what is outpatient coding? This consists of your ICD-10-CM, your CPT, and your HCPCS book, okay? This says that you're being tested on all of three of these books. And now whether you choose to go with AAPC or whether you choose to go with AHIMA is entirely up to you. I have always said that it's not an East Coast, West Coast thing. I personally do not care what association a person belongs to. I have met many very highly competent medical coders who have a CPC. And I have met many coders that are not as strong and not as competent with what they do from either association. because they just don't understand coding, but they managed to pass a test. So again, it doesn't matter to me. It is on the individual that matters, all right? But if you're taking one of these 4 main medical coding certification exams, you have to understand what these cover. So for the CCSP and the CPC, this says that you can apply for outpatient positions. This means you can apply for clinics in a hospital, right? Because oftentimes there are coders that work in a hospital. Doesn't necessarily mean that you're coding for the inpatient side, but they do need to have coders for their outpatient clinics and same-day surgeries and emergency department. These are all considered outpatient visits, okay? This person is not staying in a facility. They are just doing outpatient visits. But also, these 2 certifications, the CCSP and the CPC, they also do cover what is known as professional fee. Now, what is professional fee? So an example of professional fee coding is when you are coding for a provider who is a specialty provider, maybe they're in podiatry, and a patient has been admitted to the hospital because they have they're in diabetic ketoacidosis. Okay, so they're out of control right now with their diabetes, and when their doctor is looking over them, they say, "Oh no, you have a foot ulcer. We need to call in podiatry because they are better equipped to understand how to take care of this foot ulcer because you are a diabetic." So they call up podiatry, and podiatry says, "Oh yes, I will see this patient." But the podiatrist goes up to the floor because the patient is staying in the hospital to get themselves under control, right? Their diabetes. And then they say, "Okay, well, we're going to go ahead and take care of your foot, and we're going to get you all going, and everything's going to be good." Okay. Your job as an outpatient coder that is coding for professional fee is to see to it that that provider gets paid for their service for going up there. And if you're looking in your CPT manual, you'll see in the evaluation and management section, you'll see about those inpatient level visits, the 99221, 99222, 99223. That's your initial inpatient. And then you have your 99231, 232, and so on and so forth, okay? I can't think of them off the top of my head. And then, of course, you have your discharge day, the 99238 and 239. So those are the things that you have to know. That covers professional fee. That's your professional fee side coming out. But again, that's all outpatient, because even though the patient is inpatient, they have to be, the provider has to be paid for their professional service. So that is professional fee, or pro fee, PRO little dash FEE. I said it one time in one of the other videos, and people had a field day trying to ask me what was I trying to say. I don't know. Whatever. So if you have either one of these, the CPC or the CCSP, right? This says that you can code for any of those places. You can apply at those places. Now, if you have the CCS or the CCA, right? The Certified Coding Specialist, the gold standard, or the CCA, Certified Coding Associate. This says that you are competent on the ICD-10 CM book, the CPT book, and the ICD-10 PCS book, because those are what is covered on those 2 exams. Now, of course, there's also the payment methodologies and those kinds of things, reimbursement methodologies, but I'll get into that here in a minute. But this says when you have the CCS or the CCA, this says you can code for inpatient coding or outpatient coding, right? So even though maybe you weren't so strong on that inpatient side, but you were strong on your outpatient CPT side, evaluation and management, and all the procedures, the modifiers, right, for the outpatient side, that makes sense to you, and you want to go ahead and work in the outpatient setting, and you have the CCS, that is totally fine. You have the CCA, that's totally fine. That is what I have done throughout my entire career. I have always worked in the outpatient setting. I have done professional fee coding. I've done all of these things on the outpatient side, and I had started with my CCA. I had my CCA for 13 years, very successful with it. I stubbornly held on to it because I was proving a point. But then I had to change. So then I got my CCS. So I've had my CCS certification since, 2021? You know? So it's been a few years now since I had it. But I'm still in the outpatient setting. I know enough to get around on the inpatient side, and I could work on the inpatient side if I wanted to. But this just says I'm competent to code inpatient or outpatient coding, okay? So it's very important to understand the distinct differences between the two or the four main medical coding certifications. Now, the person had asked about the CRC, the Certified Risk Adjustment Coder. I will say this about that certification. That certification says that you know how to code for diagnosis coding only. Now, there is risk adjustment coders. Now, risk adjustment coders, this is a whole different thing, but it's only covering the diagnosis coding. Even though you say, well, that sounds easy to me. I didn't like to do the procedures anyway. And, I don't really understand evaluation and management. It's so scary, blah, blah, blah. It's not scary, guys. It is not scary, okay? But if you're saying, well, I only like to code diagnosis coding, so that sounds great to me. You are vastly limiting your abilities to get a job. Just getting the CRC and having that alone. It will not serve you well for the long haul. And the reason that I say this, and if you're getting offended, you clearly don't understand what I'm saying. If you listen to what I'm saying, you're going to understand here in a minute. There's a lot of people that say that they were so excited to get a risk adjustment job because that means that they only have to know diagnosis coding. Yes, technically. However, it's not just diagnosis coding. You still have to really understand pathophysiology. And that's where a lot of people don't understand that. You have to really understand the disease process in order to be able to be capturing those codes appropriately and accurately. And then what a lot of people tell me is that they get really bored. They got really bored because it's just diagnosis coding. So they allowed their skill set to get rusty as far as like evaluation and management and procedures and modifiers. And if they were taught ICD-10 PCS, they allowed that to lapse. They don't practice. They don't continue to go over their workbooks so they can maintain that knowledge. They don't. And that's a choice that you have, is whether or not that you are maintaining your knowledge. Now, the CRC, for when I see it in these job listings, there's people that will say, we're looking for risk adjustment coders. If you have a CPC, a CCS, CCA, CCSP, or the CRC, that's totally fine. Then I've seen some that say, well, must have a CPC and a CRC to get a CRC job. And then you don't pay extra for that. In fact, you pay less than the national average because they have a CRC. And that's what they're doing. They're doing risk adjustment coding. But you want them to have 2 credentials. And the credential, the CPC, has already tested them on their knowledge for diagnosis coding. Or if they have a CCS, CCA, or a CCSP, they've already been tested on their diagnosis knowledge. And you want them to have the CRC as well. I'm not against education. Obviously, clearly not against education. What I am against, though, is when people don't understand these credentials and they're trying to push them and you don't understand what the original credentials mean. That's what bothers me. Because then people think that they need to rack up a bunch of credentials and then they often have hard time to maintain these credentials because it's not just getting a bunch of credentials. It's paying for these exams. It is maintaining these credentials with the appropriate CEUs, continuing education units. And that's what a lot of people don't think about. Then they're panicking and posting, how can I get all these free ones? How can I get all these free ones? Well, then some of you mess around and get these specialty credentials when you don't even know what it's about. CPMA is my biggest one that I talk about because a lot of brand new people, CPCAs, right? less than 2 years of experience, y'all are getting those CPMAs. And then when I ask you what you want to do with it, what are you going to do with it? Oftentimes, I don't know. I was just told to get it. Do not get a credential when you don't even know what it's for, number one. Number two, look and see if the jobs that you're applying for, is it asking for that? Now, like I said, sometimes some people will say, well, if you want to get a CRC job, you need to have a CRC credential. Then you're only doing diagnosis coding. However, I have seen in these job listings too that say if your only experience has been in risk adjustment, they do not count that as experience. I have seen that personally on the job listings. Now, it's not on all of them, but I have seen it before. And the reason that they say that is because a person can be working for 4 years as a risk adjustment coder, but they have, oh, yes, I have 4 years of coding experience, only diagnosis coding, not procedure CPTs or anything like that, modifiers. Well, guess what happens to all of that? Because you can't just go your whole career like that. I mean, I suppose you could. And I suppose there's people that are quite happy with just coding for diagnosis coding. But that does not allow for growth. That does not allow for advancement like a lot of you all want. Because a lot of you are entering into this field with a lot of demands right away. For whom much is given, much is expected. You want a lot of these things, but then a lot of you, not all of you, but a lot of you don't want to put in those efforts to learn other things. And yes, it's a little confusing at first. Yes, it's a lot of stress in the beginning. But I had an instance where I had done a lot of clinic coding, right? And then I got moved to another supervisor, which was fine because I was getting away from a micromanager, okay? And this micromanager was helping my new supervisor to give me assignments to do, right? And one of the things that my old supervisor knew that I had not done was same-day surgeries. I had not done same-day surgeries up until that point in my career. I had been doing a lot of professional fee. So my clinic knowledge and my specialty knowledge, rather, was really vast, okay? I could do E&Ms all day long, whether it was clinic or professional fee. I could do a lot of different specialties, but I had not done same-day surgeries. Oh, and she was only so happy to give me same-day surgery assignments. And I was like, oh, okay. We're going to get this figured out. I was determined to get it figured out. And I was able to figure it out because when you are a coder, this says that you're competent. And yes, I had done procedure coding before, but I hadn't done it in quite some time since I had been certified, right? And so getting into that and learning those things, it didn't take me very long to pick it up. It didn't take me very long to sharpen my knowledge. Okay? So, and now, again, I can go anywhere and code for anything. Nothing scares me. But there's a lot of people that are going to allow that fear. Oh no, Bleu, I can't do E&M, I can't do. Yeah, you can. Yeah, you can. It's not as scary as a lot of you make it out to be. It is not as scary as a lot of you make it out to be. Same thing with procedures. Not scary at all. Not scary at all. It just takes a little bit of practice and some time. That's all it takes. Okay? If you're willing to do that, then you're willing to, grow and do a lot of things and be able to advance and find something that you really do enjoy, and not just be limited by the CRC, okay? And so that's something that you have to know. But if you have any one of these four main medical coding certifications, the CCS, the CCA, the CCSP, or the CPC, these are the ones that employers are looking for. Rarely do I see them asking for all these other little subspecialty certifications. Rarely. If your employer is paying for it, though, and they say, well, we'll pay for you to be a CRC, we'll pay for you to be a CPP, by all means, take that education and go ahead and just get all the things that they're willing to pay for. Because that's going to be a benefit to you, it's going to be a benefit to them, because they're going to ensure that their people are educated. And there are some facilities that are like that. They understand the importance of education, and they understand how expensive it is. It is a very expensive venture. The more you start adding on to your credentials, the more you start adding on to your knowledge base, it does get more expensive. But again, to whom much is given, much is expected. So they're going to expect you to have really high accuracy, really high productivity, and all of those other things, especially if they're investing in you. So you got to bring your A game, okay? That's just what I'm saying. But if you are, and to tie this video up, if you're asking this question, which one of these is easiest, do not take this exam. You are not ready. Take it when you feel confident enough to say, I know enough. I know enough, and I've studied, and I've done the 20 hours per week like Bleu has advised. It's been 90 days since I completed my program, and I've been consistently studying 20 hours per week, and I can do this. And then you go and you pick an exam and you take that exam. And for those of you that are asking me, well, what about all the other domains? How do I find those things? Guys, Google. Google. It's literally that simple, is to Google. Right? DRGs, you don't know about that? Google. Present on admission, you don't know about that? Google. And you will find tons and tons and tons of articles that will come up about that. HIPAA, the Office of the Inspector General, and all these things. Joint Commission, all these things. You can do a simple Google search and find out all the information that you need. The domains are listed on the AHIMA website or on the AAPC website about what these tests cover. Okay, and it's going to tell you this is what we're expecting you to know based on this type of setting, like whether it's physician queries or whatever the case may be. So it's going to give you those things. No one has to spoon feed you these links, guys, because I get that question a lot too. Well, why can't you just post a link? Why can't you just Google? It's that simple. Google is going to give you the latest articles about, I want to sneeze. It's going to give you the latest articles and the latest information about that particular topic. You know, for example, I've posted the independent study list, and it's got all the books listed. It's got all the links listed. Okay, I try to go back and update as much as I can every year, but sometimes it escapes me. I don't remember. And some of these videos, they don't get watched for a long time, and then all of a sudden YouTube starts pushing it out, which I'm very grateful for. And all of a sudden then people are starting to watch it again, and then they're like, oh, well, this is from a few years ago. Do you have anything that's new? You can Google that. You can Google it. It is the same access that I have to Google is the same access that you all have to Google. Everybody has the same access to Google to be able to ask these questions about it. Okay? I'm just trying to help you along the way. All right? So that's just what I'm going to say there. And that's what I'm going to say to wrap this one up. But again, if you're asking the question, which one is easy, you need to be studying more. You should not be asking that question. You should not be. Because there's a lot that we have to know. And I don't want it to overwhelm you, but I want to prepare you. I want you to be prepared, because that, above anything else, is going to be the most important thing. When you are showing your seriousness about this field and your readiness for this field, you will have more opportunities versus the person who's waiting to be spoon-fed this information or waiting to be directed in some way. Okay, we have to be able to direct ourselves, guys. And it's very easy to just do a simple search. I'm just saying. So, with that said, I'm going to wrap this one up. Study hard, guys. If you're taking any one of the 4 main medical coding certification exams, and those are the ones that I recommend. Unless you are taking, unless you're in the degree program and you're taking the RHIT and the RHIA, I recommend that as well. Or unless you are getting a credential that requires you to know CDI, like the CDIP, or if you're going with ACTIS, and you're taking the CCDS or the CCDSO, those I also recommend as well. But those CDI credentials are advanced. They are advanced credentials, and if you are a medical coder, it's going to take you years to get there. You may be able to pass the test, but it doesn't necessarily mean you're going to have the knowledge and competency behind it, okay? And if you are a nurse taking those right out of the gate, make sure that you are also getting a medical coding certification, because if you don't understand the medical coding and you're just jumping right into CDI, you're missing a big part of the puzzle. I'm just saying. So, with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I will see y'all next time. Bye.